I have acute and chronic shoulder bursitis, and the anatomy is the subscapularis bursa. It lies between the subscapularis muscle and the joint capsule. The subacromial bursa is below the acromion and above the greater tubercle of the humerus. The subdeltoid bursa is between the deltoid and the shoulder joint cavity. The subcoracoid bursa is between the coracoid process and the shoulder joint capsule. The infraspinatus bursa lies between the infraspinatus tendon and the capsule of the joint, and the subcutaneous acromial bursa lies above the acromion. Pathology. Acute shoulder bursitis is caused by short bursts of irritation to a specific bursa, and chronic shoulder bursitis is the most common type of bursitis and develops over time by repetitive irritation to a specific bursa, and that is an MRI of an inflamed bursa in the shoulder. Mechanism of injury for both chronic and acute is overuse, repetitive stress caused to the joint, repetitive friction, and it can also be caused by traumatic events, infections, or diseases. Signs and symptoms are stiff or achy feel in the joints, the greater amount of pain with movement or pressure applied to the joint, redness, swelling, disabling joint pain or the inability to move, bruising, and possible fever, which is usually a sign of infection. Special tests. Speeds. The patient sits with their elbow in extension and their forearm supinated. We palpate their bicep tendon and the long head in the bicipital groove. The other hand goes on the distal forearm and resists the motion in shoulder and elbow flexion. Pain along the bicep is positive. Nears is the patient sits, the AT stands face them with one hand on the posterior shoulder, the other on the forearm or the elbow. The AT will elevate and immediately rotate the shoulder. Pain is positive, and that is for impingement of the rotator cuff. Yoakums, you'll place the patient's affected hand on their other shoulder. You will lift their elbow. Pain is positive. For Hawkins-Kennedy's, sitting, our hand goes on a flexed elbow. Their shoulder is 90 degrees in the scapular plane. Our other hand goes on their wrist while stabilizing the elbow. Hand on the wrist passively moves the shoulder and immediately rotate, and then pain is positive. And then also you can do X-ray, MRI, or CT scans as a special test. Predisposing factors. Age, hobbies or occupations with repetitive motions, medical conditions such as arthritis, gout, or diabetes, and that is a picture of arthritic changes to the humeral head and the glenoid fossa that would inflame the bursas and make big changes in the body that would cause problems with the bursas. Recognition and differential diagnosis. It could also be an impingement of the rotator cuff, shoulder impingement, or subacromial pain syndrome. And over to the right, we have a picture of shoulder impingement. And as you can see in that little circle, it pushes down on the bursa and creates symptoms like bursitis. So it's easy to get the two confused. Management and treatment for this would be rest, NSAIDs, ice, bracing, gentle stretching, like a posterior shoulder stretch or shoulder blade squeezing, or surgery. And over to the right, you have on top the shoulder brace, or on the bottom you have shoulder surgery to inject a gel-like substance to mimic a bursa into the shoulder. Referrals and immobilization. You can refer them to an orthopedic surgeon or a physical therapist depending on the severity. And then they would also recommend bracing or wrapping for support. And over to the right, you have a shoulder spica. Prevention would be proper lifting, frequent breaks, and proper warm-up and stretching before any physical activities. Mulligan Technique, you would take the affected arm straight up with the other hand, place their fingers along the greater tuberosity or along the joint line of the shoulder to create a posterior shoulder glide, and continue this motion repetitively. And this video shows the same thing. It shows him showing her how to create the posterior shoulder glide, and then her raising her arm to create the motion. And then this is one that you can also do at home to make it easier to do rehab on yourself. And there are the 7 references, including the PICOT reference at the bottom. And then there's a PICOT analysis that was done